Hey everyone, thanks for attending tonight's virtual event featuring Nordlys. My name is Kent Harshbarger, Executive Territory Manager for Candela Medical. And before I get started, I wanted to mention two things to you all. Number one, I will be answering questions via Zoom chat after the presentation. And number two, we will be offering competitive trade-ins, extended discounts, and a 6-month marketing package for tonight's attendees. So be sure to reference the virtual event to take advantage of this amazing opportunity. I love being able to offer Nordlys to practices because it gives you the ability to offer 4 foundational technologies into one multi-platform system by offering IPL, NdYAG, Frax 1550, and Frax 1940. Nordlys IPL technology uses narrower wavelength bands per condition, which enables treatment of photo-damaged skin using less than half the fluence, no active cooling, and requiring fewer treatments than reported in clinical studies with broadband IPL devices. Nordlys doesn't require contact cooling because it has dual water filters, which removes the longer wavelengths and in return reduces absorption by water in the skin. And what does that mean to your patients? Less heat, less pain, and more importantly, less risk. You can choose to offer the PL400 handpiece, which is for pigmented lesions with the wavelength range 400 to 720 nanometers, PR530 for skin rejuvenation using 530 to 750 nanometer wavelength, the VL555 for skin rejuvenation using 555 to 950 nanometer wavelengths. And this gives you the ability to treat conditions like rosacea, port wine stains, sun damage, post-surgical scars, acne, poikiloderma savant, facial telangiectasias, and many other conditions. Then you also have the option to add hair removal with the HR600 handpiece, which is 600 to 950 nanometers, and the HRD645 for darker skin types, which is 645 to 950 nanometer wavelengths. Then you have the NdYAG, which is designed to treat benign vascular lesions such as facial telangiectasias, leg veins, venous legs, port wine stains, nail fungus, and warts. Then you have the Frax 1550, which is designed for deeper non-ablative skin resurfacing and improving skin texture. The Frax 1940 is the newest handpiece, which is designed for more superficial fractional non-ablative skin resurfacing. Both of those Frax handpieces have an intelligent roller design, so if you move the roller too slow, it won't fire. You move the roller too quickly and a warning light will be displayed. There are no pulse count limits on the handpieces. It includes a comprehensive warranty. And I really love how user-friendly the Nordlys system is, especially if you're a practice that is either new to lasers or just replacing older technology. There's a much shorter learning curve on this system, and I'll tell you why. Based on the handpieces you have plugged in, you just select the condition you'd like to treat, patient skin type, and whether they have sun exposure. Then it gives you recommended settings. It doesn't get any easier than that. This is the Frax 1550 handpiece that is designed for deeper non-ablative skin resurfacing and improving skin texture. It coagulates tissue in the dermis and stimulates collagen, while the Frax 1940 is designed for more superficial, fractional, non-ablative skin resurfacing and targets the epidermis. The benefit of both fractional handpieces is that by only treating a fraction of the skin, the entire treated area may see the impact of being treated, while only a fraction of the skin actually needs downtime. It can treat wrinkles, acne scars, post-surgical scars, pore size, stretch marks, and many other conditions. 100% of patients actually reported textural improvements with the Frax 1550, while with the Frax 1940, 100% of patients reported they were satisfied, while 44% of those patients reported they were very satisfied. You'll want to make sure that you use a topical numbing for your patients, which I would recommend a 23% lidocaine and 7% tetracaine. We typically recommend a series of 3 treatments at 4 weeks apart, and depending on settings, expect 3 to 5 days of persistent erythema. There are 3 main IPL handpieces utilized for skin rejuvenation. The VL555 handpiece, which I'm holding right now, is used to treat darker pigmented lesions, darker vessels. The PR530 handpiece, which is used to treat medium hue pigmented lesions, red vessels, and light pink vessels. We also have the PL400 for light pigmented lesions like solar-latentinodes. IPLs target chromophores are hemoglobin, oxyhemoglobin, melanin, and water. That's why it's so important that Nordlys uses dual water filters to remove the longer wavelengths to reduce absorption by water in the skin. And going back to what I said initially, this equates to less heat, less discomfort, and more importantly, less risk. Patients may feel a slight tingling or burning sensation up to 3 to 4 hours post-treatment. You can apply cool compresses, gels, or creams after the treatment for increased comfort. Avoid scratching or removing microcrust, and wear sunscreen. You can repeat treatments in 4-week intervals and inform patients that results of the second treatment will be less dramatic. The NdYAG handpiece uses clinical intelligence of the device by selecting vessel color, vessel size, and then the spot size will automatically set. It utilizes integrated soft cool technology to cool the skin, has an adjustable working white light and red aiming beam. It also includes 3 interchangeable tips to facilitate treatment. Doesn't get any smarter than that. Vessels should darken, fade, or show a visible change. Erythema or edema after the shot is indicative of coagulation of the vessel after treatment. Also, a reduction of blood flow should be noted, and additional treatments might be required. One thing I didn't highlight was the HR600 and HRD645 handpieces. Both of those are for hair removal, which I highlighted at the beginning of this virtual event. Thanks again for attending tonight's virtual event. Remember, we are offering competitive trade-ins, extended discounts, and a 6-month marketing package to any of tonight's attendees. The promotion will expire by June 25th, so make sure that you check your emails after the event and reply yes to book a consultation, and you'll be contacted to schedule. I would be sure to reply tonight as I expect my schedule to fill up quickly. And I want to be sure everyone has the opportunity to take advantage of this amazing event pricing and marketing package. Hey everybody, thanks for attending. And I'm going to go ahead and just read you guys a couple questions that I had, and feel free if you guys have additional questions, just type it in, and I'll be sure to address them out loud. One of the questions that I got was, how many treatments is that Frax 1940 and Frax 1550 typically recommended to do in combination? The study so far we have is actually a series of 3. Usually you're going to do 2 to 3 passes for each handpiece. And then other question I actually had, sorry, I'm just pulling up the list, was do you have to get all the handpieces that I referenced, or is it completely customizable? So the answer is yes, it's definitely customizable. You don't have to get all the handpieces. We can pick and choose based on what your patient's needs are, and we can always add hand pieces later. So that's one of the things I think is really important. It's very scalable. And then let me just make sure that I'm not missing any other questions. You can definitely do them. So the other question I had is, can you do them on the same day, or do you space them out a couple of weeks or months? So you can definitely do them on the same day. The study on the white paper actually shows that they did them same day, back to back, 2 to 3 passes, let the skin cool, just with enough time to actually swap out those hand pieces, and then they would start the remaining treatments. And usually you would do the same spacing 4 weeks apart. Any other questions that you guys have? The other thing I did see was about warranty. Is it all-inclusive? Or, do you have to still pay for parts, supplies, or any other things? So yes, the warranty is all inclusive. It's comprehensive. So there's no pulse count limits on your system. I know a lot of our competitors actually have pulse count limits where you have like 50,000 to 150,000 pulses. And even if you're under warranty, they'll prorate, actually purchasing another handpiece. So I think that's really important to note, especially if you're considering, replacing an existing system, for one of our competitive trade-in promotions. And let me just make sure No, so I did see that the question. I think I just answered it. There are no limited shot counts, with those hand pieces. And the other one is the trade-in. So if you have a competitor device, and you want to trade it in, I would have you just contact me directly. One of the things that we're going to be doing that I want to make sure you guys are paying close attention, whenever we get off this, you're actually going to receive a text message asking to reply yes if you're interested in setting up a consultation with me. And when we do that, we can talk about the competitive trade-ins. I'll have to get some pictures. So we'll actually shop it out to see if it's better to get trade-in credit internally, or if I can find somebody, to actually purchase that system to help lower the acquisition cost of a new system. And so all right, so another question I have is which handpiece for hair removal for darker skin? So that's the HRD 645. I know who asked this question. I did already cover that with, your coordinator too, by the way. So she's aware. And then feel free to, if you want to set up another call with me, you can call me on my cell, and just reply yes, and we'll coordinate a time to discuss a little further so we can narrow down those hand pieces for you. The other thing I have is what is the marketing program? So this, to me, is very exciting. A lot of people complain to me about the support they get on the marketing side, and how there's all these additional costs every time they want to make a change with anything. So Aesthetics Integrity Group, who actually helped me put this event together, which I'm very grateful for. So thanks to Summer and Randy. They actually have a program, 6 months, where they're going to cover everything, social media posts, virtual events, 6 newsletters, 1 per month. And then you have some different options that you can choose from with geo-targeted ads, SEO packages, on-site video, photo shoot, website design, so pretty wide range. It's really going to be just based on what your needs are. I love working with them. I've tried some other marketing partners in the past, and I've just been blown away with the results. Even from the virtual events, a lot of my customers are really happy with the results it's producing, including like 22 treatments, 24 treatments, just from, having these type of events like we're having right now. Other question I have, so I mentioned this earlier. I was asked, do I need to purchase all the hand pieces? The answer is no. I would want to set up that phone consultation, by you replying yes to the text message that you're going to get immediately after this event. And we will set up a time to discuss, what patients are asking for, what you feel like you need, and then I can make suggestions. One thing that I think is important to note, according to the ASPS report, the top 7 most requested non-surgical cosmetic procedures were non-ablated skin resurfacing, hair removal, and IPL. So they're all in the top 7. So those are just things to think about when you're trying to decide on what hand pieces you want to add to the platform. And then what is the difference between Frax 1940 and Frax 1550? So Frax 1550 is really going to be more for a lot of your texture regularities, and deeper lines and wrinkles. Whereas the 1940 tends to target more pigmentation issues. We have some off-label uses, like I'm hearing a lot of, melasma and things like that. They're also being treated, but also some of that, like aged skin on the chest. It might be a little bit more difficult to treat with some of the other wavelengths because it might need to go a little deeper. That's where you're going to find a lot of success with that. I also like the Frax 1550 for off-label. We're seeing more offices that are actually treating with lips for temporary lip plumping, which is great, especially to complement your filler patients. If they have an event and they don't want all the bruising, they can actually come in, do a treatment maybe 2 to 3 days, before a reunion or wedding. That's what I'm actually finding a lot of like buzz and excitement about, to be able to offer that to their patients. And then, okay. I think that's it with the questions. If anybody has anything else, let me know. I'm glad you guys were all able to attend and appreciate everybody's time. And feel free, again, just make sure that you reply yes. You're going to get a text message, and we'll set up a phone consultation. I do expect a lot of demand for this. Nordlys is by far my favorite product in our entire portfolio. So you definitely want to be one of the first in your area to be able to offer it. And feel free to reach out to me directly. Thanks again, everybody, and I will talk to you all soon. Take care.